So far we've talked about solid tumors, lumps you can scan and often cut out. Blood cancers are different in a fundamental way. They arise in the cells of the blood and immune system, so they're spread through the body from the very start. You can't remove them with surgery. But some of oncology's greatest triumphs, and some of its most futuristic treatments, live right here. Let's meet the three main families. First, leukemia, cancer of the blood-forming cells in the bone marrow. The marrow starts churning out abnormal white blood cells that don't work and don't stop multiplying, and they crowd out the healthy cells the body needs, leading to anemia, infections, and bleeding. The most important split is between acute and chronic. Acute leukemias come on fast and aggressively, and they're a medical emergency requiring immediate, intensive treatment. Chronic leukemias develop slowly, sometimes over years, and some are so indolent that, like low-risk prostate cancer, they're simply monitored at first. You'll hear four main types named by letters, but the big idea is that same acute versus chronic divide: how fast is it moving? The second family is lymphoma, cancer of the lymphatic system, the network of nodes and vessels that's part of your immune defense. It often shows up as a painless, swollen lymph node in the neck, armpit, or groin. Lymphoma splits into two broad groups. Hodgkin lymphoma, which tends to strike younger people, is one of the true success stories of oncology. It's now one of the most curable of all cancers. The non-Hodgkin lymphomas are a large, varied group that ranges from slow and indolent to fast and aggressive. The third family is myeloma, a cancer of plasma cells, the cells that make antibodies. Because plasma cells live in the bone marrow, myeloma characteristically eats away at the bones, causing pain and fractures, and it remains treatable but generally not curable. Now for one of the most important stories in all of cancer medicine, and it happened in a blood cancer. Chronic myeloid leukemia is driven by one specific abnormal protein, produced by a single genetic accident. In the early 2000s, a drug called imatinib, brand name Gleevec, was designed to block that exact protein. The result was staggering: a leukemia that used to be fatal became a manageable condition, controlled by a daily pill, with many patients living a near-normal lifespan. It was the proof of concept for the entire idea of targeted therapy: find the one molecular flaw driving a cancer, and design a drug to shut it off. Much of modern precision oncology traces back to this one leukemia. Blood cancers are also where the most dramatic treatments live. The stem cell transplant, which we introduced earlier, wipes out the diseased marrow with very high-dose therapy and then rebuilds the blood system from healthy donor or patient stem cells, and for some leukemias and lymphomas, it's curative. And then there's the newest frontier, CAR-T cell therapy. Here, doctors collect a patient's own immune T cells, genetically re-engineer them in the lab to recognize the cancer, grow them by the millions, and infuse them back in as a living drug that hunts the disease. In some patients with leukemia, lymphoma, or myeloma who had exhausted every other option, CAR-T cells have produced complete remissions. We'll come back to how it works, but it started here, in the blood cancers. So the takeaway for blood cancers flips the usual intuition. Yes, they're frightening in that you can't point to them or cut them out, they're everywhere in the blood and marrow from the start. But that same feature means they're treated entirely with systemic medicine, and that is precisely the arena where targeted drugs, transplants, and cell therapies are most powerful. From Hodgkin lymphoma, now among the most curable of all cancers, to chronic leukemia controlled for decades by a daily pill, many blood cancers are among the most treatable there are, and they've repeatedly been the place where the future of cancer treatment arrived first. This is educational, not medical advice.